Hello, everybody. Thank you for joining us for our therapy and counseling career panel. And we will have this recording available in the future. So if you want to refer to it, or if you have friends who couldn't join today, you can find a link to this recording on our Yellow Cluster Advising website. So we are so excited to introduce our panelists who are representing therapy professions. As psychology and cognitive science students at UC Davis, you may, as I'm assuming you've joined this event, be interested in some kind of counseling or therapy career. Often students have questions about the differences in options that they have to pursue such a career, and that is the purpose of the event today. We will have each panelist spend a few minutes introducing themselves and their work and the journey that they took to get there. And then the remainder of our event today will be focused on audience questions. So as we're going along, feel free to jot down your questions and ask them when you have a chance, or you can proactively throw your question into the Zoom chat and we will keep a note and ask them when we can. So this is meant to be an engaging event, and I'm excited to see what kind of questions y'all are going to ask. So I'm going to have each panelist go ahead and introduce themselves, and I will be calling on you so we don't awkwardly transition. We're going to start with Dr. Gill.
Thank you, Stacy. Good afternoon, everyone. My name is Dr. Gill, and I'm a board certified clinical psychologist. I currently work at the Academic and Staff Assistance Program at UC Davis, and I also operate a private practice. And so I'll talk a little bit about my educational journey that led to this career in this current position. So I started with a bachelor's degree in liberal studies, actually, for elementary education, and then went into a master's degree in educational administration and leadership with a specialization in student affairs. And then went into a doctoral program, and in the course of completing that doctoral program, picked up a master's degree in psychology and eventually the doctorate degree in clinical psychology. And so that was kind of the education portion. And then my career has been predominantly in higher education, and I knew that I wanted to work with an adult population, an outpatient population, and so that is part of the work that I do now. And I knew that I also wanted to be in an administrative role and kind of look at how policies and procedures around mental health services are shaped, how different populations can access mental health services, in particular marginalized populations. And so I knew that I wanted to have an administrative piece to my work. And then I was also really interested in teaching and supervising. And so that's a portion of what I do now, and wanting to be able to influence the curriculum that is taught to future psychologists and help them as they kind of navigate their professional career. And so my current position has kind of a blend of those pieces. I do some therapy, some teaching and training, some consultation work, some violence risk prevention and consultation work on campus. And so kind of a blend of positions that I've had in the past, but predominantly, again, within higher education and within adult outpatient population.
Thank you. Next, let's hear from Shannon Stewart-Maver.
Thank you, Stacy. Hi, my name is Shannon Stewart-Maver. So I am licensed as a marriage and family therapist and a licensed professional clinical counselor. And then I decided to go back and get my doctorate at age 40. And so I'm at the tail end of completing that. And whenever you complete your doctorate in counseling, clinical, or school psychology, the last year is a full-time internship. And so I'm doing my internship here at UC Davis Student Health and Counseling Services. So kind of my background is I got both my bachelor's in psychology and my master's in counseling psychology up at Humboldt State. Graduated with that in 2004. So I had a range of different jobs as a psychotherapist, as an MFT, mostly with folks with kind of severe mental health issues or trauma. So my first job was in a crisis unit where most of the folks coming in the door were having either significant suicide ideation or have some sort of kind of other kind of intense presenting issues such as psychosis. When I left that, I worked predominantly almost 10 years working with kids with pretty severe mental health stuff, a lot of trauma background in an outpatient day treatment setting, as well as while I was doing that, also I was working as the therapist in a shelter for kids when they were moved for the home for protective custody by child welfare services. So I did that for many years. I loved that job. I love working with kids, but it was also very hard and kind of emotionally taxing. And so when I decided to have my own children, I decided that I needed that emotional energy to have at home. So I left that position for a little bit and then opened a private practice and then started teaching as an adjunct professor at the place I got my bachelor's and master's degree, teaching undergraduate psychology and master's level counseling psychology classes. And so in private practice, my kind of areas end up focusing on still working with adolescents and families, particularly families with kind of multicultural backgrounds, but also anxiety, still trauma, and the LGBTQIA plus community. And there was a lot of need in the area it was from. There's still a lot of need. It's kind of a rural area for folks who worked with trans clients. And I was one of the few up there. So that was one of kind of my focus areas. I decided to come back to school for many, many reasons. I always kind of intended to, but just life kind of kept going after my master's and getting licensed. I decided I can talk about why I decided to get the licensed professional clinical counselor and the differences. I can go back to that if someone has questions about that. But I got that in 2014. But part of my reasons for going back was, first of all, when I started teaching, I was at the encouragement of my former thesis advisor, and I had no idea how much I'd love it. Like, I really love working with students. I love teaching. I love working with folks who are thinking about going in this field. I think it's a really great feeling. On the top of that, because it was a really rural area, there was a lot of lacking in different types of services for different kind of marginalized groups. And I felt like I didn't know how to address it. And I think that's reflected in, I went back in the specialization areas. I kind of got fellowships in my doctoral program. We're focused on working with rural folks. Well, in Iowa, which is where I ended up going to my doctoral program. But now here at UC Davis, I do individual therapy, I do groups, and my emphasis area is community outreach. So for me, again, programming and doing outreach to different folks on campus is really important to me. So that's kind of my focus areas here.
Thank you. And let's hear from Dr. Shi.
Hello, everyone. Thank you, Stacy. My name is Shi. I go by Brian, one of the licensed clinical staff psychologists at UC Davis Student Health and Counseling Services. And I also work as a clinical supervisor, supervising trainees at the center. So my background, if we were to travel back, I knew that I wanted to do something within the helping profession at a relatively young age, just knowing what some of my strengths are as an individual, although I didn't know what exactly that would look like. So I had aspirations in around middle or high school time. And so when I went to college, I decided to major in psychology, and I attended UCLA for undergrad. And while I was there, the courses of psychology primarily are research-based. And so that was what I learned regarding psychology at the time. And, you know, being somebody of Asian descent, as well as an immigrant, and some of you guys may relate to this, but psychology isn't necessarily a good discipline that traditional Asian families are most familiar with. And so I made a promise to my parents to trust me in my own decision-making when it comes to my own career, and that I am going to pursue psychology and I'm going to go all the way to make sure that there is that sense of security. And so I think that did it. And I'm very fortunate to have immigrant parents who are supportive in terms of my career pursuits. And so with that said, I applied for doctoral programs in psychology, and I ended up becoming a student at Arizona State University's Counseling Psychology PhD program. And I applied directly out of undergraduate. And so I was fortunate to have also obtained my master's degree while pursuing my PhD in my PhD program. And during my graduate journey, initially I was convinced that I was going to go the research route, that I was going to become a professor one day. And this was something that I was passionate about and what I learned in undergrad. And what you'll discover if you decide to go this path is that in your graduate journey, there are also a lot of opportunities to learn things that you were not initially exposed to as an undergrad. And so for me, that was opportunities to teach classes, opportunities to do clinical work. And as part of our graduate training, we are required to do yearly clinical work, working with clients of all different sorts of backgrounds. And I discovered that that was a new passion of mine that I didn't know about previously. Really enjoyed my experiences doing clinical work, had experiences working in university counseling centers, as well as community mental health agencies and a substance abuse treatment facility. Really enjoyed my experiences doing all of that. And so after I graduated, I decided to pursue a full-time career in clinical work specifically. And currently I am very fortunate to be working as a staff psychologist here at UC Davis Counseling Services. Primarily, my job responsibilities involve individual therapy. Clients are, as you would expect, university students, so both at the undergraduate and graduate level. Individual therapy, sometimes couples counseling. We also offer group therapy services. And shameless plug, one of the groups that I'm facilitating is the Gaming Support Group, which is a supportive space for individuals who identify as gaming enthusiasts to talk about gaming specific concerns. So we're still recruiting for that. So if you're interested in joining or being a part of that group, please contact UC Davis Counseling Services. Other job responsibilities. So I am a clinical supervisor, so I do work with a trainee at the doctorate level and supervisor work. We also offer crisis services. And so I myself do deliver crisis services and crisis visits for students who are in crisis. And that could be anything that walks in the door, between difficulty coping with a breakup to having very intense suicidal thoughts. And so anything in between and even beyond that. I think that pretty much covers my primary job responsibilities for my current position.
Thank you. All right, so now we're going to transition to our question and answer portion of the event. So audience, you can post any question for either the whole panel or for individuals on the panel by putting the question in the Zoom chat, and we will make sure that the question is addressed. And to get us started, while you all are thinking of what kind of questions you want to ask, I will start us out with having each of the panelists describe what they like least and best about their current work.
So I would say that, some of the aspects that I really enjoy would be the ability to teach and train and be able to start to kind of think about how we might do outreach or deliver services to populations that are marginalized and so wouldn't otherwise come in for individual psychotherapy. And so those two aspects of the work that I do, I really enjoy right now. I would say at least, one of the things that makes it challenging is there are a lot of systems that are are quite powerful systems that have been at play for some time. And so that really influences the way in which people are able to receive mental health services, and really who is able to receive mental health services. And so that makes it challenging. Over the course of my career, I've worked in programs that offer services to Medi-Cal population, to insured populations, free or low cost services. And you really see the discrepancies, in number of staff, number of resources that are allocated, and so, and who you're able to serve, and how well you're able to provide services. And so I think some of those pieces make it challenging, and again, make the work more complicated. And so the aspect of the work that's perhaps kind of least fulfilling is interacting with those systems where there's barriers to care, and kind of either working towards a solution, or kind of accepting the way that the system is, and then kind of trying to figure out how to get people care around that.
Shannon or Brian?
So for me, like hands down, what I love most is I love working with people. So for me, the therapy relationship, whether that's individual and group, I particularly like doing individual because you kind of build up that connection kind of in a one-to-one kind of way. But I also love doing outreach. Like I did outreach last night for like chemical engineering club, and it was just so fun. And it's, and it's funny to just kind of say that, being like, it's so fun to talk about anxiety, but like, that's what the workshop was about. But just connecting with people and being able to talk about things that are sometimes like, hard to talk about or really vulnerable, and just holding kind of safe space for that. I love that piece of it. Kind of echoing what Dr. Gill said, it's like, for me, the barriers to access are just so hard. And, it's very hard for me when it's like, wow, and trying to schedule a student, it's farther out. And when maybe like ideally you would see them much sooner, but that's all the availability you have. That is really hard. And sometimes it's hard in many different ways. But I think trying to support students in navigating barriers to getting kind of like the therapy care, I think is frustrating for me too, as well as them, and knowing that's not the easiest. And so in terms of just like the kind of day-to-day stuff, I think just sometimes navigating, as an intern, you have a very full schedule. It's a 44-hour work week. And so just navigating, getting all the technical stuff done, like paperwork, when, like in terms of everything else, that is just very hard to juggle sometimes in like a full-time clinical position. And on days when like maybe there's a lot of kind of challenging kind of emotional work, it's harder to just have that energy to do some of the stuff like sit down and do the notes. I'll just name that.
Yeah, I think for me, very similarly, I very much enjoy working with people and seeing clients make actual improvements in their lives, and it like that's visible, and the client can see that within their own lives. It's really fulfilling being a catalyst of that type of improvement that clients see within themselves. It's great. I think the least enjoyable aspects of my work would definitely be the paperwork that's associated with the sessions, because that's like a lot of typing, and you got to put some stuff down on paper for record keeping and ethical reasons. And so for me, that's just the least enjoyable aspect of my work.
Okay, so we've gotten a whole lot of questions in the chat. The first one is, what do you wish you knew when applying to grad school? And that's for all the panelists.
I can start if that's okay with the other panelists. When I initially got accepted to my PhD program, I was super excited, and I felt like, oh, this was going to be the start of a new life, and it's very exciting, and it is very exciting. And when you get into a competitive program, of course, there is that moment of celebration. but I wish I also knew just the amount of sacrifices that you also have to make if you are planning to pursue a PhD like I did, in that there is quite a bit of time commitment that's involved. And once you're in your program and kind of doing what you're required to do as a student, sometimes there's a lot of responsibilities, and it's really hard to balance everything that you have to do as a student in a program. And so I wished I knew more about that before going in.
I think similarly, by the time that I reached my doctoral program, it would have been nice going in knowing the length of time that would truly be required before you could be practicing independently, also known as making money. And so the reality of, the program and the length of the program, I've made it through them on the other side, but as somebody who trains and supervises others, I've watched really, incredibly intelligent, ambitious, competent people consider other options after they've completed their doctoral program, because there's still several years of requirements that they're looking to fulfill after that. And so for independent practice, at least, and again, to really be able to have, not even a competitive salary, just really a livable salary. And so I think that piece, for myself and for others that I've supervised, where they're depending on that to be able to finance their life. I think the field has shifted, and as we've included individuals from diverse backgrounds, we're recognizing that the need that these are not necessarily people who are coming from affluent families or having resources or partners or spouses to kind of support them through that process. And so I think there's lots of opportunities there to build in support. But again, those are not currently in place. And so I know, again, myself, others in similar situations who, the length of that time and the amount before you're really able to make a livable wage is quite some time. And so had I been able to prepare for that going in, that would have been nice to know. The way that I managed that was that, extending at times working, multiple roles, or taking a pause in between pre and postdoctoral training, to be able to save for postdoctoral wages. And a lot of that, again, it's, being addressed, it's changing. There are people working on that currently, but I think length of time, cost of, expenses that happen after your doctoral training, particularly if you're depending on academic loans, those loans are not available once you're, graduated. And again, you're working to complete licensure requirements. And needing to be able to pay for those exams, to be able to pay for the prep materials. And so those things add up quite quickly.
It's the money aspect. I really feel like, I'll try to name it tactfully. It's just like I feel like you need a decent amount of money, sometimes even just to apply to graduate school. For applications, back in 2017, they were a minimum of $100 each application. And so there's that piece. Knowing that, so now that I'm naming that, also being aware, kind of look at how much competition do you have when you are applying to different places? Because some of the clinical programs I applied to, for example, had over 850 applicants. So you might be much less likely to get in, even if you are a stellar student with straight A's and this fabulous background, and do you want to spend the $100, $150 there? Because often people do apply, they try applying to it's recommended you apply to sometimes 10 places, that's $1,000, and then where, depending where you get in, there's not doctoral programs in counseling or clinical everywhere. And then you also may be trying to aim for places that offer funding. So you may have to be more mobile and be more open to where you're moving. I ended up moving to Iowa, and they did give me full funding, but the cost of moving cross country to go there is one thing. And then when you do internship your last year, it's not like a regular job where you apply different places and you get to choose where to go. There's this ranking system where you rank the places you applied to and interviewed at, and they rank you. And there's this day where randomly you're told where you're going to live for the next year. And so you have to be like open. And I have a family, I got kids. And so like everyone's, and that can cause stuff, you know, it's like, we don't know we're going to live next year until February 11th. And all of a sudden we're going to know. And then moving back there again. And then there's this, the testing you have to do, which I think the EPPP is about $1,000. I mean, it's just like, there's almost this expectation like of, I mean, you're either going to go into serious debt, or maybe you come from a very privileged background and get a PhD. And I think the latter is kind of, I feel kind of concerning at a kind of societal level, but it's a barrier for people to get higher education degrees. And I just want to name that.
All right, so our next question is for Shannon. What is the difference between an LMFT and a LPCC when it comes to schooling and training? And then also there's another question. How do the LPCC and MFT differ in the day-to-day job activities?
Okay. It's kind of going to be a little bit of the same answer. There's slightly different classes and slightly, I think at this point, it's 3 more for the LPCC that you would have to take as opposed to MFT. And so kind of what's really different about the two is the scope of practice. And what I mean by scope of practice, it's kind of like where you are trained and so where you are competent to work. And so when you are coming in from, first of all, LPCC is pretty new in California compared to other counseling master's level licenses. The other two are marriage and family therapist and licensed clinical social worker. So from a psychology degree, you can go the MFT or the LPCC. But it's pretty new. And so marriage and family therapist really focuses on relationships. And so we do individual therapy, but a lot of the mindset is also looking about like different things that are related to relationship with yourself and relationship to other people. And there's whole distinct parts of your training that are focused on working with families, working with couples, or working with relationships in general. And that's a huge part of your training. We're also trained to work with children in the whole range of like the spectrum of development. LPCC folks come in and they don't necessarily get that training in working with families or couples. So they may have to specifically go out there and get that separately in order to practice working with those areas, because you should not work with people when you don't have the training. Work with the type of people. So LPCC, it's very interesting because when it didn't originate in California, it's sometimes called LPC. In other places, it actually originated as a vocational and educational license, and then kind of expanded more into mental health. So background kind of has more work with children, but it's kind of more educationally based. Here, it's not now how it's kind of evolved. It does focus on mental health, but it's more from an individual level. And there's areas that are not necessarily covered under MFT, such as career counseling, such as educational counseling, those kinds of things. So to be just transparent, part of the reason I decided to get the second one, 2 reasons. One is it expanded my scope of practice because you can also do different assessments as an LPCC that you can't use as an LMFT. And additionally, it's way easier to transfer an LPCC license from state to state than a California LMFT to anywhere besides like Oregon. There might be another state in there. And the reason for that is that California, my understanding is, so if I'm really wrong, I'm sorry, but this is what was told to me, is that we have one of the oldest kind of criteria for a marriage and family therapist license. And most other states actually kind of made theirs collaboratively. And so our list looks different. So it's difficult to transfer. And so part of the thing is at the time when I got the license too, was like, I may move out of California. And so for me, it was easier to kind of transfer that as well. But so primarily difference in scope. Do you want to work with families and children too? You might want to go more the MFT route and couples. Or if you're just like, no, I want to work with individual adults and do career stuff, do these different kinds of things, LPCC might make more sense.
All right. The next question is for everyone. What kind of things were you involved in during undergrad? Anything not research related?
I'll jump in. I did all kinds of things. I was volunteer for, on my campus, there was a mentor program for kids who were working with the county mental health system, that their case managers kind of linked us, and we went and did like community activities and just, developed relationships with kids who were kind of at risk. I became a program director for that program when I was an undergrad. I worked at a crisis shelter for youth. I worked on a crisis line. I started working with older folks in the community that just kind of needed more, like they wanted people to be able to socialize. They were feeling kind of isolated. You can kind of see the theme. I was looking for things in my community where just being present with people, and part of the healing process was just kind of through relationships.
Most of my experiences in undergrad were in research. And yeah, so it really made sense for me to pursue a graduate degree that do specialize in research, so PhD degree. I had very little clinical experiences. I think the only thing that I did while in undergrad that would be semi-categorized as clinical would be working as a peer advisor in the UCLA Career Center. And I think that's like the only thing that I had that would be semi-classified as clinical.
Similarly, I think my undergrad, I certainly had experiences where I knew I was interested in working in a helping profession, but it wasn't yet clarified. And in fact, the degree was not even in psychology. And so I think opportunities to work with children, work with low-income populations, things that I knew that I cared about, and over the years kind of, shaped together, have contributed to what I do. And but at the time, it wasn't, clearly directed towards clinical psychology. And so certainly, I think the population and kind of interest in working with others, helping others through, difficult or challenging times was of interest. And so I would find ways to kind of get those experiences.
And then Dr. Gill, somebody's asking if you did a PsyD or a PhD, and then can you maybe talk about the differences?
Absolutely. So my program was a PsyD, which is a doctorate in psychology. A PhD is a doctorate in philosophy. And so the differences are, in terms of the academic program, perhaps the direction and kind of focus of the courses. And then sometimes there's this question, of what does it mean on the back end? So what are my career options going to be? And I think as others can, address here as well, that are getting their doctoral degree, completed their doctoral degree, is that we're each kind of working, in a somewhat similar role, maybe coming at it from a slightly different angle, but the options for your career, I wouldn't necessarily say are limited, from one or the other. You might have a little bit more of a focus on one. I've certainly worked in research clinics. I've done research as somebody with a PsyD. I've worked with clinical populations. I've worked with in administrative roles. I've done outreach. And so I think focus of the program and the way in which the courses are taught, again, they're kind of from a particular philosophy. I think another difference, earlier we were talking about the financial impact, is that it is often the case that PhD programs are a little bit better in terms of offering teaching assistantships, research assistantships, which might help support tuition. My experience in a PsyD program, others that I know, that's less often the case. And so you are often, paying a larger portion of that tuition yourself or through loans. And then cohort size is sometimes a difference. And so PsyD cohorts, within the academic program might be a little bit larger. So you may have 12 to 20 people in your courses. PhD programs might have a bit of a smaller cohort. But again, some of that depends on, which institution you go to. And so I would say if you're considering the two, certainly look at cost, look at things in terms of, the location, the availability of how many programs there might be in California, if you're interested in staying in California. That being said, by the time you get to internship, and postdoctoral training and early career, I would say for myself, it required the flexibility to be able to move around quite a bit and to be able to take those positions that are offered through the match process, or especially early career, to be competitive, the flexibility and being able to move around was helpful.
All right, and then for everyone on the panel, since clinical and counseling doctoral programs are extremely competitive and the acceptance rates are intimidating, how did you beat the sense of imposter syndrome and know that you were ready to be in such an intense applicant pool?
I think to some extent, so I think of imposter syndrome and, we've spoken, I think each of us about the financial reality, cultural diversity factors, right? As these systems were not made for us in mind. And so when the academic programs were developed, they were, developed for people who perhaps had the financial means or who had the ability to relocate or who had the support. And so I think when people are experiencing imposter syndrome, I encourage them to think about, is it really you, or is it the system was designed intentionally with you not in mind? And so it wasn't designed for you to be there, for you to fit in, for you to have a sense of belonging. And so to kind of reconceptualize, where the problem really is. And that then kind of orients you to look for solutions, not only for yourself, but maybe others like yourself. And so I think that I was fortunate in the sense that I had my own mentors and my own kind of conceptualization from a feminist liberation psychology perspective to kind of think about what is imposter syndrome really. And then, when you're experiencing it on an individual level, if you can conceptualize it accurately as kind of a problem in society, and then from there move towards, okay, well, how do I navigate this myself, knowing that it wasn't designed, with me in mind, and how do I help support others so that we can arrive at solutions.
I think having a sense of conviction definitely does help. I've shared with folks regarding my narrative and that I made a promise to my parents that I was going to pursue to the highest degree. And I acknowledge that not everybody has that kind of backstory to their experiences. But I think the more experience that you get as an undergrad, so for instance, if you are looking to pursue, let's say, a PhD degree, that you be getting some research experiences, volunteering at labs, and then if you're able to take coursework that would allow you to actually write a manuscript and like design your own study. I was fortunate that I was able to do that in one of my classes and actually get my project published in a journal. And that was very helpful, of course, in terms of pursuing a PhD degree. So I think the more experiences that you get that are relevant while you're in undergrad, I hope that you would also gain a sense of confidence that comes along with that.
I think my situation was a little different. That I'd already, there's I think a level of like, I've been licensed for about 13 years before I, started looking at other schools. And there's this almost like sense of like defiance. Like I said, I went back to teach. And, when you're an adjunct, like for the amount of work I was putting in as an adjunct professor, I was getting paid less than minimum wage, based on what I'm paying. And just kind of looking at that time, a lot of the older faculty had retired. And so I'm like, I'm not tenure track, but I have more clinical experience than the tenure track folks here. And I'm getting paid dirt, and like, so just feeling like this level of defiance about that. And wanting the, and there's just, there is a difference in how people view you when you have a master's versus a PhD. And I very much felt that. So for me, there was this kind of like, no, I'm gonna go get it because darn it, I want, I want this level of respect and maybe the pay to go with it. And I don't know that I'm not gonna go back to do tenure. I'm not going that route. I thought about it for a while at this point in my life, but yeah. So for me there, I think, Brian kind of brought the mindset of like conviction. And I felt that too. I'm like, no, I'm going back. And that was just, that overshadowed any kind of like imposter system, though it is anxiety producing. Absolutely. The whole process is.
Okay. So question for Shannon. How important do you think picking the right grad school is ultimately? And then the student said, I've heard most of what you actually learn comes during your practice.
I do think it's important to get in a school that is a relatively good match for you. And you didn't name a type of degree, so I will just kind of name some things across both. But for example, so certain types of programs may lean more towards a medical model in terms of clinical work in psychology. And some people are really into that. There's a lot of things that kind of come with that in terms of like focusing on diagnostics, focusing on treatment in a certain way. And then there's other models that no, they go a different route, or maybe they're focused more on like a multicultural orientation. That was my program. And that's one of the reasons they really focused on a multicultural orientation, humility, and kind of integrating that throughout all of practice. I would have felt more uncomfortable in a medical model that doesn't fit me so much. Like I've worked in hospitals and stuff, but I still feel like I can navigate who I am. But for me, part of the multicultural and the identity piece and how identities and culture impact us all and in terms of our health was really important. So I'd go that route. There's also, just looking at your programs, a lot of programs you are asking to work with a specific professor. And that can be in terms of research interest, that it can also be in terms of clinical interest. And that sometimes is, I got to name like working with an advisor that you are aligned in terms of your goals and what you want to do and actually understand the research topics you're interested in makes your life so much easier. If you can just think about like, first of all, you're both excited about the same thing. They can help you learn how to get funding about those things. And like, it's sometimes hard. I had a substitute advisor a couple times, different times for different things. I had my advisor was out and they're just like, I don't even know what to tell you because this is not my topic area. So not having that support, I felt like prolonged the time I had to get my thesis done. It just gets in the way of something. So I think having a good match can be helpful in many ways. But I do want to highlight, you did important points. Look at your programs and see what kind of practicums they do. Like University of Iowa, I did a million things. I did a homeless program. I did an LGBTQ clinic. I did a university counseling setting. And some places you go only have a university counseling setting, for example. So if you want a diversity or you're looking for something specific, I would look at that. What is the training?
Okay, we have a question from an international student that's interesting. They're going to get their bachelor's in psychology in June, and then going to grad school isn't an option right now, and they're planning to apply for OPT to continue their stay, which is a form that needs to get filled out if they want to work. So they want to know what jobs and career roles would the panel recommend to look into that would accept just a bachelor's degree and would gain them experience in the mental health field.
So I can name some. With the psychology degree, some of the things that students I know have, friends I know have done, you can do anything in kind of behavior analysis that is acceptable at a bachelor's level. So that can be a one-on-one aid to a child with, say, who's on the autistic spectrum in the school setting, that's sometimes doing work in the homes, that's kind of behavioral kind of work. You can work in different, they often like having people with psychology degrees that work in different kind of crisis shelters, working on crisis lines, providing support in special education classrooms, those kinds of things. And what else? Working sometimes in schools. A lot of times when you're looking at when I've been on where you're for at least master's level, looking at applicants for students coming into a master's program. And they're really looking for like things where you're working with people and dealing with different challenging situations. So that can look differently across different ways. It doesn't have to be like, this is a psychology job, if that makes sense.
It's a hard question to answer because a lot of jobs specifically related to psychology, most of them do require advanced degrees. And so I think for the most part, you are looking into more of those types of entry-level positions just to get some kind of experience or exposure in the field. And it's really hard, just acknowledging the challenge of just naming specific positions that would be helpful to partake in as somebody who only has a bachelor's degree. That is a bit of a challenge.
I would say look into, whether it's county systems or hospitals, positions that are along the lines of somebody who's doing maybe intake work, case coordination, case management type of work. And again, there might be, a requirement that there's some kind of supervision being provided to you, but some of those kind of early skills you can use in terms of asking questions, listening, gathering information. I will also say, if you're interested in staying at UC Davis, there's junior specialist positions at both the campus and at the medical campus. And so those are positions typically, 1 to 3 year positions where I've supervised people who are in those positions and they're essentially finished with their bachelor's degree. They're working in those positions to gain experience and to still kind of try to navigate their options as far as what kind of graduate program they might want to go into, whether they're going into medicine, PhD, master's level degree in psychology, whatever they're kind of navigating those career options and graduate school options. And those are employed positions that are classified as junior specialist positions.
Okay, next question. For those who have done both a master's and doctorate degrees, do you feel there was a benefit to doing both degrees? Do you feel like your master's was a good use of your time?
For me, yeah, I think there was a very significant distinction. I learned a lot of things in my master's degrees that were not covered in my PhD in terms of counseling work. And part of it is the slight difference in the type of degree. I'm getting a counseling psychology doctorate, excuse me. And in my marriage and family therapy, program, I really appreciate that. I learned to work with families and children and relationship issues and issues related to that. So being trained specifically, and I know in California they do this, but in Iowa not so much. There's like sexuality training and working with different sexual issues. There was more training on substance use and stuff than there was in my doctoral program. And I do feel, and there was more focus specifically just because it was counseling psychology masters. That's all you're doing is focusing on counseling psychology with research in terms of a thesis. But I think you're just spread more thin in terms of your doctorate. You're doing this amount of time for research, this amount of time for teaching, this amount of time for clinical. And so I feel like it got, I don't know, in many ways, there was a lot more kind of different types of counseling training in my master's program.
My journey is a little bit different since I applied directly to a PhD program after obtaining my undergraduate degree. And I got what is called a master's in passing in my program, which means that I get my master's degree while pursuing my PhD degree. So my journey looks a little bit different. It's not necessarily like an intentional sort of pursuit for a master's degree first before applying for a PhD.
And I think in my case, my master's degree, the first one was in another field. And then similarly, the second one kind of got picked up through the course of the doctoral program. And so I think that I would say that they're beneficial to the extent that they give me different lenses that I can, look at a problem through, and kind of the combination of all of them, probably contribute to solutions that I come up with or the way in which I look at something. And so I would say they're beneficial in the sense that I, picked up a couple of different ways to look at something and then try to figure out, okay, well, what's the best solution going to be? Because each person is going to want to approach, challenges in their life differently. There's going to be a number of other factors that they're dealing with. And so I think they kind of come together to inform my overall conceptualization of what might be going on. And then I work in an academic setting. And so that background of kind of understanding university setting, a student affairs culture, that helps, even within the, even though my specific focus is within mental health, it helps to know what other, departments are doing and kind of how the university operates as a whole.
Hello, I'm going to interrupt just to introduce another panelist who has joined us late, and we're so lucky that he can join us. Dr. Paul, can you please introduce yourself?
Yes, I'm so sorry to all the panelists, everybody's listening that I'm so late. I am floating in, I think there's a lot of stress going on in the world, and that's partially why I'm having some brain freeze. But yeah, I'll introduce myself. My official title, I'm a child adolescent psychiatrist. I'm also an adult boarded psychiatrist. And I graduated from UC, I'm a UC Davis graduate, graduated back a while back in 2000, and then moved forward from there to go to medical school. And after 4 years in Michigan State, went to New York City to start my adult training, and finished it at University of Florida, and then did a fellowship in child psychiatry at University of Florida as well. I think, I work with everybody. I have someone who's 90 in my practice. I have kids as young as 3, and I tend to, I think, thinking about what would make my patient population different, I tend to work with some of the most ill people. I mean, obviously, most of them are coming to me because they're needing to be on medication, wanting to be put on medication or considered it. So I have quite a few people with bipolar, a handful of people. I'm in private practice, so I have a handful of people with more severe illnesses like schizophrenia, alcohol dependence, anxiety, depression, personality disorders. It's sort of that runs the gamut. I know most of the panelists on here probably see a lot of that overlap as well. Yep. I'm just looking at this list. Educational. So most of the time I spend doing both supportive therapy and or different techniques, cognitive behavioral therapy, other things to while using medications, while managing medication. So my visits are usually shorter than probably a typical therapy session, but I do find it super important to have a strong background in therapy, and I do have quite a few therapy cases too. It tends to be what I'm more comfortable with, which is older adolescents and adults rather than children. Yeah. So that's sort of me in a nutshell. Thanks for letting me join so late, guys.
Thank you. I'm sure we'll have questions coming up for you.
All right, so somebody asked a question that us advisors can answer. They want to know if a clinical or therapist career requires a student to earn a bachelor's of science degree in their undergraduate. And the answer to that is no. A Bachelor of Arts is fine for many programs, master's and PhD. So don't feel like you have to take all the science, because you really don't. Okay, let's see, next question. Oh, this is a good one. Who gave all of you help, if any, in your graduate school applications? And how were you able to find someone or multiple people who were able to give you very honest feedback about your CV and other components?
I can, oh,
Go ahead. No.
go ahead, Shannon. Me first? Okay. For me, I worked as a peer advisor when I attended undergrad, and one of the perks was that we had a career library. And so I knew that I wanted to pursue a graduate degree in psychology from the get-go. So I spent a lot of time there looking through the books and trying to find information, did my own research. And that was primarily how I started in terms of looking for graduate programs to apply to that I felt like was a good fit for me. And yeah, so that's how I started my journey in terms of the things that are required. So like personal statements, letters of recs, those aspects for the most part, I really try to navigate on my own. And once I felt like I had something that could be looked at by other professionals, I utilized my career center as an undergrad to advisors to look through some of my personal statements and make recommendations. So that was helpful. I think for the most part, that's how I navigated the graduate school application process.
So for me, and I hated the graduate school application process, particularly writing the personal statement was just so nerve-wracking. I basically asked lots of people for feedback to look at that in my CV. It was easier when going into a PhD program because at the master's level, you're always asking professors, that, like, hey, could you look at this? And then at PhD level, luckily I had colleagues at that point who had been through the process. And so asking people who I knew would give very honest feedback, and a lot of my friends give very honest feedback, and so does my partner, was really helpful because, having people you trust kind of go to part. And then having psychologists, I know, I had a friend whose friends were willing to share like what their personal statements look like, so that I was like looking and seeing like, well, whose do I like the best, and like what, I was also Googling too, but it was nice to just have other people's and being like, so what would I want to include in mine? But yeah, I think just asking lots of people for feedback who are in the field was particularly helpful.
I think, early on, it was the campus resources, so career center, advisors, faculty. And then by the time I was in the doctoral program, it was really faculty within the doctoral program and kind of support through that process and being able to get their feedback and the cohort that I had. And so we were kind of going through a similar process and being able to exchange ideas and help support each other. So we certainly, reviewed each other's application processes for internship, postdoctoral, opportunities. And I think early career as well was making sure that we continued to have that support system in place so that we could help each other in terms of applications at the early career stages.
Okay, next question. Someone said they're hoping to pursue art therapy and specifically work with children enduring grief and trauma. How do you protect your own mental health while dealing with so much heaviness?
Yeah, I mean, you get into your own therapy. I think everyone probably, I don't know, most people who I know who are really introspective about this stuff and have been doing this stuff for a while and can keep everything separate or in their own therapy that, or supervision, I think, through different periods. That's my short answer.
And it is in our program, it was certainly a requirement that we attend therapy ourselves as part of our training. And I think it's encouraged professionally to be able to continue and then also be able to recognize, signs of vicarious trauma, secondary trauma, which are kind of the terms that we use to explain that phenomenon of, when your work is perhaps impacting you to the extent that it's now causing that separation, that ability to kind of maintain your private life in a whole and holistic manner. And so there is some professional literature about those topics, and they're incredibly common amongst helping professionals. And so I typically, when I train and supervise people, recommend that they kind of have a sense for themselves what their warning signs are, and to think about it as something to prepare for, more of when it happens than if it happens, because again, it is incredibly common.
Just to add on to that, I think it's really important to prioritize your own wellness as a mental health provider, in that, it really, the quality of the services that you deliver to some extent is also dependent on how you are. And so if you're not well, then there is a possibility that your patients would also suffer from the services that you're delivering. And so prioritizing yourself and identifying what your needs are as a provider is especially important.
Okay, so we have two related questions. Somebody said that they've heard that grad programs discourage working while in the program. So how did you financially support yourself through grad school? And the other question was, is it reasonable to pursue a PsyD or PhD for clinical psych while working full-time? So those two go together.
Well, I started my master's program working 3 jobs because that's where I was at financially. And my professor saw me, and he's like, you need to quit 2 of those, keep the one with the shortest, and you need to take out a loan, because it was just, it was too much. And it was very hard because financially I was independent and needed to take care of myself. I would, if you are able to get into a doctoral program with funding, which I'm very grateful I did, you are working, like if you have an assistantship, it's typically, there are quarter-time ones, but they're also half-time ones. So they're 20 hours a week. And that is a job that you can work and is kind of expected. I can't imagine doing a full-time job on top. Like I'm doing a full-time job now, and to do some of the finish up like the different research papers and get them into like publishers and just little things, and just, being a mom and everything else is really hard with a full-time job. And particularly if you're doing counseling, it's just, there's a potential for a lot of stress. And then you add just you're a student. So I would personally think that would be very challenging. So that's just my little 2 cents.
Yeah, I think to add on to what Shannon has already shared with everyone, when I was looking for graduate programs, I was specifically looking, one of my top criteria is that the program that I'm applying to must have some level of funding to fund the education. And so that's just a search criteria that I encourage folks to kind of look into when you're doing your own research for programs to apply to. And to give like a rough breakdown of what my graduate student schedule looked like, we had our classes. That's about, I think, 3 classes per semester. We had to do clinical work. So that's about 20 hours a week that we work offsite somewhere in an agency delivering clinical services. I had to do 20 hours of assistantship to pay for my tuition and to get some level of living expenses. I was working on research projects on the side and progressing with my thesis and dissertation. And so that's additional time that you need to have. And then you also have homework in your grad courses. It's not like a cakewalk, at least not from my experience. There's actually higher expectations from the faculty in my program for graduate students. And I think there's like other things that goes along with that busy schedule. So hopefully that gives you a sense of what your schedule could look like if you are pursuing a graduate program.
Okay. Is it possible to do shadowing in the different psychology careers? How do you suggest we go about contacting professionals in the field since there is that confidentiality factor involved?
I mean, I think in private practice, getting someone to, in my setting, for example, I have people approach me quite a bit. I'm sure everyone else will say comment, but it in private practice is just not practical to bring someone into shadow at that level. But I think there's lots of different ways you could get involved with the clinic, especially a larger multi-practice clinic or a university type clinic, or a larger nonprofit, to be involved with stuff is organizing toys in the playroom, or I mean, I know it sounds kind of like, well, what's that worth? But I mean, you get to meet people, rub shoulders with people, see the kind of work environment, the kind of people that are in that, setting, the clients, if you will. So I think that's probably the most practical way. That's kind of what my thought was.
Okay, we have an interesting question. Are there any personality traits or habits that would be an impediment in these career paths that one should consider working on before going into it?
This is, I think for any of us where it helps to know yourself and to have that insight and awareness, which can come through psychotherapy, your own psychotherapy, can come through, other contemplative meditative practices you might have. And it might look a little different for each of us, but again, I think kind of knowing, where your own vulnerabilities are, knowing your own background and history, essentially, where do your things begin and end and where do your clients begin and end? And so clinically, we might call that countertransference, but kind of a sense of, okay, well, what is it that I'm bringing into the space, and what are assets and strengths of that, and again, what might be vulnerabilities or limitations? I'd say we all have some. It's just kind of a sense of getting to know your own and knowing how they're impacting the work that you're doing. I think many of the common ones that I see that lead people to either secondary traumatic stress, vicarious trauma, burnout, are kind of lack of boundaries, excessive caretaking. It's sort of a sense of maybe not having the competence or the scope of practice that's being expected of you. That could be an organizational issue, staffing issue. And so I think there's several, but having some kind of practice early on that allows you to have that insight of awareness really helps.
Yeah, I think those are great qualities and things to acknowledge about yourself. I think to add on to what's already been shared, a sense of openness can be very helpful. Whenever you start doing something initially, of course, it's natural to have certain expectations about what you're doing. And sometimes your realities may not necessarily align with the initial expectations that you have. And so it could be helpful to just be a little bit more flexible and be more open to some of the experiences that you might receive.
Okay, for all panelists, do you feel you have a good work-life balance in your current position?
I think it's a constant, it's a constant discussion I have to have with myself, and making sure I'm not taking on more. I think particularly right now, the way mental health is, we're flowing over many times. Thinking about it on an ongoing basis. But yeah, I do. I mean, I set my own limits. I'm in private practice. I can say no. I worked my way to get here. I think a lot of us, it takes time to get to a point where you can maneuver things like that. I was in public health for a few years at a clinic, which was chaotic, and couldn't say no a lot of times. But yeah, the balance, I think it's waxed and waned, but being conscious of it and keeping it in the mirror has allowed me to feel like I have most weeks, pretty good handle on it.
I agree with Dr. Paul. I think with any position, there are always pros and cons, pluses and minuses. For the most part, speaking for myself, I'm very content with my current occupation and position. And yeah, there's not a lot to complain about from my end.
So I'll just be very real and transparent in that. No, I don't. And I think that is sometimes an expectation as an intern. It's that, it's a 44-hour work week. I also have things I'm wrapping up for my degree. I'm a parent of 2 young kids. And right now, no. And I think, but for me, what's nice is there's an end. Like, I'm a trainee and I am completing my degree in a couple months. A lot of these things are done then. And while I will be continuing as a postdoc trainee, it just is a little different. And I will have a little bit more wrapped up. And with that too, to be honest, I mean, you're not paid very significantly as an intern, and just having also more, money as a postdoc and then later as a licensed person just also helps too, and be able to just kind of do other things that are more convenient to kind of do self-care.
Yeah, I mean, even to get in, I have small children too, and it doesn't stop, right? I work about 7, 8 clinical hours a day, which is a lot. I work 4 days a week. I take Fridays off. It's supposed to be me time. It never is. I'm at my kid's school. I'm working on a project. I'm talking to a friend. I'll wake up early, super early to work out so I can get myself feeling good and centered. And I think that's super important, having physical work. I recommend that to everyone I see. And I think for me, it's super important. So, I mean, you have to push sometimes to get those things in. But, definitely when I was in my first job, it was a struggle to pack myself lunch. And I highly recommend that too. I still pack my own lunch, make sure it's healthy, and don't eat the free food that people set out for you. At least in the medical setting, it gets pretty unhealthy pretty quick.
I think, as everyone has acknowledged, it is something that to some extent, there's time periods where it's more out of your control. And then when there's those periods of time where you have a little bit more autonomy, a little bit more flexibility, it certainly helps, resources help. And so I don't think it's a point that we arrive at. I think it's something we're striving towards, and we occasionally get there, and it's in a changing situation. And so I've had different roles in the field, and each come with their own stressors and different responsibilities. And so I think it's certainly something to kind of keep striving towards and keep working towards. But there's certainly more to be done than there are, people to do it within the profession. And I think as you're all interested in going into mental health, it is certainly a field that, needs more people.
Okay, the very last question we have for you all. Can you give tips about finding opportunities in your field or becoming qualified for your field?
I think it's kind of a broad question because there's so many things, first of all, you can do in our field, but I would just really name like, what are you interested in or passionate about? Can you find volunteer positions in it? Can you find paid positions in it? Can you participate in things that, and it may not be directly related to psychology or something else, but doing those kinds of things. If you are interested in potentially doing research, joining labs, joining people's research projects, some of the best people on my research team were undergrads, and then doing other things, like what other kind of like social justice things can you get involved in? What, looking for things you're passionate about and kind of pursuing them, because a lot of the things that you're very interested in terms of people, in terms of justice, in terms of research, in terms of whatever it is, often you will kind of manifest in your clinical work and your research work in other areas. So I think it's kind of broad. I know, and maybe that's not quite the answer you're looking for, but like kind of looking for opportunities, like if you're interested in working with kids, finding things to work with kids in different kinds of capacities, for example, I think just is really helpful.
Yeah, I would piggyback on that. I mean, I was a psychology undergraduate major. I did a year abroad. I learned Spanish. I lived in Granada. That set me on a totally different arc. I volunteered going to Mexico with the doctor, translating. And, that made my application pop. That gave me a totally different worldview and informed what I wanted to do. But I was also in love with what I was doing, and it was fun. And I think I got good letters because of it. And I think, just like Shanna's saying, you manifest it. I always tell when I work with kids, adolescents, or college age kids, do what you love. Do what you love. Be passionate about it, and that'll come through and shine through for your character and help you, be attracted to or attract the people that will help shape where you're going. Big believer.
Maybe an unconventional way for folks to get more experience is to also pursue a master's degree. And through that, I think you'll be able to get experience through coursework. If there's clinical rotations, you'll get hands-on experience doing clinical work. And so a lot of folks do take that path to first get some experience and then decide what they want ultimately, whether that be to pursue licensure at the master's level, to pursue a PhD or PsyD degree, or to venture into a completely different field. So that's also perhaps an unconventional option that folks may consider if they're looking to get more experience.
And I think on that note is, somewhat of my path was that unconventional path, in the sense that I was in a different field and transferring over and being able to translate how those experiences and skills would translate over and offer a lens, right, that was maybe unique or holistic in a little bit of a different way, that others, had one lens looking at it in this kind of broad, diverse perspective from a different professional background. And so I think, regardless of kind of what you're doing, if you're able to see kind of how it weaves together, you can then, translate that to others and kind of help identify some of the skills or strengths you might have picked up in some of the other experiences and how they're going to be useful for what you end up doing.
All right, thank you to each and every one of our panelists. We value your time. Thank you for choosing to spend it with us and helping psychology and cognitive science students at UC Davis. as they're trying to navigate the many options they have in landing in a therapy or counseling profession. So students, thank you for joining us, and we will have this video posted soon at the end of the week for the, it'll be at the website for this event on the Yellow Cluster Advising website. And thank you again, everybody. Have a good night.